Hello, and welcome to this session in our Bone Matters series. Today we're talking about anorexia and how it affects bone health. And I'm very pleased to be joined by Professor Jennie Walsh, who's a specialist in metabolic bone disease in Sheffield. Jennie, thank you for joining us.
Hello, Cassie. Thank you very much for having me.
That's lovely. So, on to our first question, if I may. Can you tell us just what is anorexia nervosa?
So, anorexia nervosa is an eating disorder and a mental health condition. And people who have anorexia try to keep their body weight very low, and they might do this by reducing the amount that they eat, or by doing a lot of exercise, or by taking laxatives and making themselves vomit. They often have a disordered perception of what their body weight is, which makes them try to get thinner and thinner. And I think it's important to say that men and women of any age can get anorexia, and I think it is really often missed or under-recognised in men, but it does most commonly present in young women and often are in sort of teenage and young adult years. We should probably also mention bulimia, which is another eating disorder and mental health condition. Bulimia manifests a bit differently, that people with bulimia often binge eat and then purge by making themselves sick or taking laxatives. But people with bulimia tend to get not as low body weight as people with anorexia do. It can still cause bone problems, but the bit of scientific evidence we have suggests that it's more of bone problems and more of a feature of anorexia than they are of bulimia.
Right, thank you. And so, how does anorexia affect bone health?
So we know that anorexia causes low bone density, which means that bones are weaker, and that increases the risk of having fractures, broken bones. And people with anorexia are about twice as likely to have a fracture as people in the population without anorexia. And the way anorexia affects bone strength is quite complicated because it has a few effects. The first is that bones need nutrition, particularly calcium and protein. And so if your intake of nutrients is reduced, then that does have a direct effect on how well fed your bones are and how strong your bones are. The second thing is that people with low body weight due to anorexia have a decrease in their estrogen levels, or testosterone for men. And estrogen is really important for bone strength, as we know from what we see when women go through the menopause. And people with very low body weight will stop having periods. And that means that there isn't enough estrogen to help keep their bones healthy.
Mm.
And then the third thing is that the sort of biological stress of the low body weight and poor nutrition in anorexia causes other hormonal responses as well. So things like high cortisol and low growth hormone, and all of those other hormones also have effects on your bones. So it's quite a complicated thing that there are several different things having effects on bones in anorexia. And we know that the people with the lowest body weight and people that lose weight the fastest, and the people that have had longer duration of anorexia or been without their periods for longest, are the people that tend to have the lowest bone density and the higher risk of fracture.
Right, yes, thank you. So, if you are somebody that has anorexia, how do you know if you might be at risk of osteoporosis? And does this mean that you should be having a bone density scan?
Yeah, that's an important question. There is some guidance on this from NICE. And what they recommend is that in children and young people, if they've been underweight for a year, then they should have a bone density measurement. Or for older adults, that if they've been underweight for 2 years, they should have a bone density measurement. But the addition to that is in people that have had a fracture, a broken bone, or that have other reasons as well why they might have low bone density, such as having had steroid treatment or the usual other risk factors we think about. They should probably have a scan a little bit sooner if they do have low body weight.
So, if you're a younger adult with anorexia, what's the best way to help your bone health if you are in this situation with anorexia?
So the best way to treat low bone density is to treat the anorexia and restore body weight and regular periods. And there are studies that show that in people who do manage to improve their body weight, then their bone density does improve. But obviously anorexia is a complicated and serious disorder, and it's not as simple for many people as saying, well, just, if get your anorexia better and your bones will get better.
Yeah.
So while the underlying anorexia is being treated, the things people can do to help their bones are all the usual lifestyle things we would recommend. So that's don't smoke, keep alcohol intake below 14 units a week. Would often recommend a calcium and vitamin D supplement as well, but that would be something to talk to your medical team about to make sure that that is suitable for you before you start taking a supplement. If your risk of fracture is very high, then your doctor might suggest that you do take some medication specifically for your bones. And in younger women, there are studies that show that estrogen patches can be quite helpful in keeping bone density healthy or improving bone density in people with low bone density. So that would often be the first choice for younger women who are at high risk of fracture.
And that would be very much something their doctor's looking at for them rather than a widespread one size fits all.
Absolutely. And this is really key to anything we say about anorexia. It's a complex disorder and it's different for every individual patient. And so the recommendations that you get from your medical team will be very much individualized to you.
Yeah, absolutely. And so would this be the same for older adults?
In terms of the general lifestyle advice, yes, all of that holds at any age. So smoking, alcohol, calcium, vitamin D. The thing that might be different for older people is that if you do need specific medication for your bones because you're at high risk, the medication that your medical team recommend might be different. They might suggest a bisphosphonate for someone who's older rather than estrogen. And that's because different studies have shown that different treatments tend to be more effective at different ages.
Right, absolutely. And obviously we know exercise is very important for bone health. It's one of those things that we always talk about in terms of lifestyle generally anyway. But should people with anorexia limit the amount of exercise they do? Would there be anything different there?
Yeah, this is a really difficult question. This is definitely one of the areas where advice needs to be really individualized for patients. As you say, we know that exercise is important for keeping bones healthy, and it's one of the things we talk about with patients a lot. But for people with anorexia, over-exercising behaviour can be one of the features of their disorder and one of the ways that they control their body weight. So people should really talk to their own healthcare team about appropriate exercise advice for them. In people who have got particularly very low bone density in their spine, or the very unlucky people who've had spine fractures, then we definitely advise that they avoid heavy lifting or high impact exercise. And I will flag that the Royal Osteoporosis Society has got some excellent safe exercise advice for people with spine osteoporosis. If it is safe for people to do exercise, the best exercise to keep your bones healthy is probably a combination of some direct impact for your bones. Things like walking is good, and a little bit of resistance exercise. So that would be things like, small weights or body weight exercises. But yeah, this is an area where it's really important to emphasize that you should talk to your eating disorders advisors about what exercise would be appropriate for you to do at the stage of your treatment.
Lovely, absolutely. And as Jenny said, we've got a lot of information on our website about all aspects of lifestyle and bone health. And do look below the video when you look at it on our website here or on other sources at the links below for useful further information. Well, that's been a really useful chat, Jenny. Thank you. It's been a good introduction to the topic. Thank you so much for taking the time to come and talk to us today. We really appreciate it.
Always a pleasure. Thank you very much.
Thank you.